The viral ice cube trick circulating on TikTok, which involves placing an ice cube on the back of the neck to stop an anxiety attack, may appear to offer an instant and simple solution to a distressing problem. It's based on the idea that the cold sensation stimulates the vagus nerve, which is responsible for triggering the parasympathetic nervous system, the body's natural counter to the fight or flight response. This, in turn, helps induce relaxation. While this concept seems promising and the ice cube trick does offer immediate, albeit temporary, relief, there are critical concerns to address. First, while it's true that the vagus nerve plays a vital role in regulating the body's stress responses, relying on such a quick-fix approach to manage anxiety could be dangerously reductive. Anxiety attacks, especially severe ones, are complex physiological and psychological events. They cannot always be controlled with a simple external stimulus. The vagus nerve might be activated by the cold, but this doesn't address the underlying factors that contribute to frequent anxiety attacks, such as trauma, chronic stress, or imbalances in neurotransmitters. In fact, using an ice cube as a method of coping might provide fleeting comfort, but it does nothing to challenge the root causes of anxiety. It encourages individuals to focus on quick, surface-level fixes rather than seeking deeper, more sustainable solutions. Secondly, the effectiveness of the ice cube trick is based largely on distraction and immediate physiological response. When placed on the back of the neck, the cold sensation draws the mind's attention away from the anxiety-induced racing thoughts, momentarily relieving the mental overload. While this can offer temporary reprieve, it is important to remember that this relief is often short-lived. Anxiety attacks are recurrent and usually require long-term strategies for management, such as cognitive behavioral therapy, CBT, mindfulness practices, and professional psychological support. Encouraging people to rely on tricks like this could prevent them from seeking more effective, structured treatment plans that address the core issues. Additionally, the widespread promotion of this quick fix, particularly through platforms like TikTok, could contribute to misinformation about the nature of anxiety and panic attacks. It risks downplaying the seriousness of mental health conditions by presenting them as something that can be cured with a simple, accessible tool. This oversimplification could lead individuals to feel more frustrated or powerless when these temporary tricks don't provide lasting relief, potentially exacerbating their anxiety or discouraging them from pursuing appropriate medical help. It's also worth noting that such methods may not work for everyone. People with severe or chronic anxiety disorders may find little to no relief from these tactics. For those with heightened sensitivity to cold or those who are prone to physical reactions from such stimuli, this trick could even backfire, adding an additional layer of discomfort or distress in an already overwhelming situation. While the ice cube trick may provide some short-term distraction from anxiety, it should not be considered a comprehensive solution. Using it as a stopgap measure could inadvertently promote avoidance behaviors and lead to unhealthy reliance on temporary fixes. More substantial, evidence-based interventions such as therapy, lifestyle changes, and medications, when appropriate, are vital components of a sustainable approach to managing anxiety disorders. Ignoring these in favor of simple distractions could ultimately prolong the suffering of those affected, leaving them vulnerable to more intense episodes in the future. In conclusion, while using an ice cube on the back of the neck might offer immediate relief in some cases, it is not a cure for anxiety. It is crucial to acknowledge the complexity of anxiety disorders and to address them through informed, multifaceted approaches. If this viral trick provides temporary relief, that's fine, but it must be part of a broader mental health strategy that includes professional guidance and long-term solutions.